currently mental health is leading the way. I will go ahead and share my screen. We've got reproductive health at 15, nutrition equal, diseases and other. Okay, I will leave that poll up for a few more minutes while people join in, but I think we'll go ahead and get started. As Adam said, we've got two great speakers today, as well as a video presentation. I think that we'll go ahead and get started with Anurag. He is the director of the Council of Scientific and Industrial Research. This is his old title, I think. He is now the dean at Ashoka University. And Anurag, I think we've got to update our website for you. But maybe you can give us a brief introduction of yourself and then go ahead and get started. He joins us today as the co-chair of the commission. After Anurag, we'll go ahead and have a video followed by Emanuele and then breakout rooms. So Anurag, over to you.
Thank you very much, Whitney. I'm basically a physician scientist by training. I trained as a pulmonary critical care specialist, worked at the Baylor College of Medicine, moved into molecular biology, moved into genomics, joined an institute of genomics and integrative biology, did my PhD in molecular physiology, eventually became its director, then moved into digital health and global health because of earlier interests. And this is the key, perhaps in my mind, to answering the question that many of you have. Why do we need diversity in global health leadership? I currently chair the WHO's SARS-CoV-2 Viral Evolution Advisory Group. I'm neither a virologist nor an evolutionary biologist. I'm a respiratory physician. It's a respiratory disease. I do molecular biology. But most importantly, what you realize when you take up these jobs is global health leadership, or in fact, any interdisciplinary space where a policy decision needs to be made, is really about the ability to understand a large number of people, an ability to listen to a large number of viewpoints, try to reconcile differences, and communicate to the people who actually implement, who are typically not doctors. Many of you, knowing by the Medical Students Association, are probably with a medical background. However, almost all of you know that when it comes to whichever part of the world you live in, health policy is not written by doctors. At most, doctors implement the health policy laid down by others. They advise the people who lay down the health policy. And when new things come, very often doctors are as unaware of the new problem as anyone else. I know that Rand will be speaking in his lecture about the COVID pandemic. So let me start very quickly from there. So when COVID-19 came, all of you realize there was no doctor in this entire world who knew exactly what to do for these patients. We know what to do for people who are toxic. We know what to do for people who are having a pneumonia. We know what to do for people who are critically ill, but we don't necessarily know what to do when an entire population, people are falling ill suddenly. We can't chart the trajectory of the disease. We cannot suddenly invent new drugs. We don't know the molecular things that are required. And for this, you need a team. A doctor is a member of the team, just like anyone else. And the ability of a doctor to work as part of this disciplinary team containing people from multiple disciplines, hardcore researchers, virologists, imaging specialists, pulmonary specialists, people who know how to build hospitals. If healthcare runs short, oxygen is short, you will need people who know how to generate oxygen, transport oxygen, deliver oxygen. That might be the most important thing in solving the problem compared to a doctor who knows what to do once oxygen has arrived. And this understanding, to my mind, ability to work with people is what is critical. And I will take one last example before I stop and you listen to Rand, and I'm sure Rand will drive the same point. Take something as simple as vaccines. We didn't invent them. We can administer them. We can help people administer them. But very importantly, if you want vaccination to change the course of pandemic, it needs to get into arms. It's a matter of beliefs. It's a matter of supply chains. It's a matter of convincing people that this is good for them. And this is where engagement, very broad engagement across multiple sector society, perhaps even including religious leaders, is critical. And this was experienced in many parts of the world. Those who had the best science and perhaps the most learned doctors did not always do the best. Those who had a health support system, a public health system where leaders got engaged into the process, they did far, far better. And I will not point out any particular countries, but I think all of you know what I'm talking about. I'll stop here. Back to you, Whitney. I think now we'll lecture by
Ran. Yeah, thank you, Anurag. I think it's a great introduction to kind of get you all thinking about some of the qualities and traits that not only individuals, but also the larger community has and shared during specific pandemic phase. So it's true, I'm going to go ahead and share a video now. It's from Ran Ballister. He was also a commissioner on the Governing Health Futures Commission. And Ran is the founding director of Clade Research Institute and the Chief Innovation Officer as well. And he is based in Israel. So I'll go ahead and share my screen.
Hello, my name is Ran Ballister. I'm the Chief Innovation Officer for Clalit, Israel's largest healthcare organization, and I also serve as the chair of the Israeli expert team on COVID-19 response. And I'd like to share with you some ways in which data has been helping us in Israel and at Clalit to tackle the pandemic. Now, when a pandemic comes to play and you want to tackle it, one of the first things that you need to know is that the things that work usually are the things that will be effective also in crisis. And so what we usually do at Clalit is to look at patients and try to see the future. What kind of risks await them in the future and how can we help them get them out of harm's way? In the daily care, this means, for instance, we identify patients 5 years before they reach a state of end-stage renal disease, and we call them proactively. Their physicians call them proactively to prevent this illness through early intervention. So this is a paradigm shift from a patient-level reactive therapeutics to a population health approach that is predictive, proactive, and preventive. And so when COVID-19 came, we really tried to do what we normally do, which means very early on, we created a predictive model of which of our patients, if they get COVID-19, they will have severe illness. And to the highest risk group, 200,000 people, their physicians, their GPs called each and every one of these 200,000 people as early as March 2020, based on their prediction of high risk. And they told them, stay home, or if you need care, call us and we will either come home or provide you with online care. And this is how we prevented a lot of infections. We still use these predictive models at Clalit to this day by identifying patients that were infected and are at high risk, and we provide them with Paxlovid and other medications to reduce the risk of severe morbidity. Another way by which we've used data in real time was to support public health decision-making. In this example from January 2021, we were already in a month-long lockdown, and we didn't know if we can open the lockdown or not, if disease will go down. We've been vaccinating for over a month, but we didn't know whether in real world the vaccines would be as effective in reducing severe illness and infection as they did in the clinical trials. So there were big challenges, methodological challenges on how you can compare the vaccinated and unvaccinated with all the baseline differences between these groups. But we managed to tackle this with an approach that is kind of creating very strong alignment, digital twins, if you'd like, of patients that did and did not get vaccinated, and then emulating a target trial with a prospective approach. This created a series of publications on effectiveness and safety of the vaccines. But on that point in time, what it really showed us was that the vaccine was very effective. It reduced infection by 94% and severe illness. And so we knew we could open the lockdown. And we opened the lockdown, and indeed morbidity came down. So I think these are a few examples that have helped us make the right decision-making, identify the difference between variants, and being able to warn that even though we have vaccinated, there is still going to be continuation and a risk of new surges of the disease. And so this data-driven approach has helped us a lot. And to this day, this is how we try to do our daily care in improvement and innovation cycles, using data-driven tools, implementing them at scale, evaluating them, and hopefully with a learning healthcare system, continuously improving towards more universal and more effective care for all. Thank you.
Okay, wonderful. So we really wanted to call on Rand there specifically to kind of provide you all with a practical case example. If you remember yesterday, Katri, this was one of her main points, right? Is that we always need to kind of give this practical way to policymakers or decision makers to show what's been successful. And I think it's always interesting to have even just if it's a short few minute video and hear from someone that's kind of been living through something that worked well. And also to have those leadership qualities at the population level that went well. Go ahead, Anurag.
Let me just add something I thought Rand would mention, but he didn't. So, but Rand in a different talk was mentioning very clearly that to convince people of ultra-Orthodox communities to take the vaccines. From the very beginning, for example, they went out and engaged with the religious leaders, made sure the messaging came out from every possible direction, including politicians, religious people. And that's one of the reasons why the mass vaccination attempts of Israel were so successful in the beginning when vaccines really worked well. I'll stop there.
That's great, Anurag. Thank you. Because I agree. I think I've heard him say that before as well, but he didn't mention it. And also just the idea of kind of also seeing in this case how data and digital approach to the vaccine really worked. So I think with that, so far we've got this Anurag's experience is very diverse, coming from biology and science, genomics. Now he's on advisory panels, but he still carries that with him in all he does. Rand's practical example of being a medical doctor, but also working at the public health level to really get the vaccine rollout to be successful. And now we're going to move over to Emanuele, who has had extensive experience in the humanitarian sector, which I know a lot of you are interested in. And he currently is the director of programming at the WHO Foundation, but has a lot of years of experience practicing physician as well as kind of working in the field, and now has had several years of leadership roles in international organizations. So Emanuele, over to you.
Thank you very much, Whitney, and warm greetings to all of you. I will be a bit personal on this presentation and just tell you a little bit about my story, and then hopefully I can come to conclusions that can be useful for you. I come from a small village in the Alps, from a family that didn't have any experience at the international level. I knew pretty early that I wanted to be a doctor, and I would have never imagined that I would end up being in global health. What changed my life was IFMSA. I became part of it as soon as I joined the medical school in Italy, and then I started using the opportunity of the exchange during the summer and using my summers to go to different places. So I was in Heidelberg, I was in Göttingen, I went to Liverpool, and then I was able also to start my experiences in low-income countries. So I had a fantastic experience in Kenya in a hospital, and then just before graduation, I went to Calcutta in an MCH clinic where I got a feel of what global public health could be. And when I was supposed to go and enter the school of specialization as a child neuropsychiatrist, I decided I didn't want that, and I wanted to explore a little bit more this area. So I went and follow a course on humanitarian assistance, found a person from the Red Cross that gave a presentation. I went to him and I say, I want to do what you are doing. What should you do? What should I do? And he told me, you should do a master in public health. And if you can, try to do it in a very good place where you can learn. And I did that at Hopkins, and I found my crowd. As a medical student, I love medicine, but I was always a bit different from those who were interested in hearts or interested in eyes, And then I started being surrounded by people that had this love for working on population data and moving the health of many people. And then I started going into programs that are offered internationally, that are competitive, the junior program officers of the UN that allow me to enter the WHO in the regional office in Cairo first, and then moving to Somalia, working on the Middle East. And then I was able to join the Young Professional Program of the World Bank, where I worked 5 years, focusing primarily on Afghanistan, on the first HIV/AIDS program in the country, on the large primary health care program in the country based on contracting out of services, which is still the basis of the provision of services in the country. And I was working on India also, supporting the largest global program on tuberculosis prevention and control. And I was living a fascinating life out of Washington, spending a lot of time in the countries, but I realized that I want to go back into more closer to where the action was happening. And then I moved to UNICEF Mozambique, and in Maputo, I spent 4 years working on large immunizations campaigns for children. In 5 days, the entire governments and UNICEF will be able to vaccinate 5 million kids, quite remarkable, large malaria control programs, and so on. Fantastic experience. And then life hits you, as it happens. When you go internationally, you still have family issues. I lost my mother, I lost my grandmother while I was down there, got a call come up in 24 hours. And I had 2 small kids. We decided with my wife maybe to go back to closer home. And so we tried to go to Geneva. Difficult to get there, but eventually I managed to get there. And I just want to cut story short. I got a position as a director in the WHO. It was somehow the perfect circle. I started from there as a JPO, and then I came back. It was the worst job of my life, and I ran away. And I would have never imagined I would run away from it, but the environment was toxic, and I just ran away. And then I went to the Red Cross as a director of health for the Red Cross, and I closed another circle from the speech that I heard 20 years before. And there I had the best job of my life, which was dealing with working with the Red Cross volunteers all over the world and supporting their work during the Ebola crisis in Congo, but particularly during the COVID, where I was really lucky to have the privilege to support 192 national societies, providing a lot of support to people in many countries. And then I changed again, and I'm with a startup that I'm the staff number 3. We had money to run only for 2 months. Now we have money to run for a year. I changed completely. This is to say 3 things. One, that you should have curiosity in your life and be willing to change, be willing to learn. You have many more opportunities than I had when the internet was very, very small. Follow people on Twitter, get as many access to the economists, to the journals that are there. Try to get in touch with the people that you can now reach more easily than it was possible 20 years ago. And take the chances, travel, discover new places. Second, go and do practical experience as much as possible. And you may travel far away from your own country, but there are a lot of needs in your countries. And what I would say is exercise your humanity, find your humanity by supporting the migrants that are in your community, by supporting the people. You mentioned mental health issues, the youth population has mental health issues. Try to be there and learn from it. And then third, be courageous, jump, don't be hesitant. The future really is depends on the courage of the people like you. So keep your curiosity, strengthen your humanity, and then be courageous. And for me, those are critical elements of leadership, regardless of the kind of work you're going to be doing, whether you're going to be a CEO or not. That's true leadership. That's what will hopefully allow you one day to look at yourself in the mirror and find a person that you actually can live with and you may even like. I'll stop here. Thank you very much for the opportunity. Over to you, Whitney.
Thank you so much, Emanuele. I'm sure all of you can kind of hear his passion, and I really kind of echo this because Emanuele is very supportive of all of the youth engagement work that we've done over the last few years with the Commission, and super supportive of ever doing anything that he can to support our collaboration with IFMSA. So I'm very happy he was able to join us today. I did just want to really quickly, because these are great, this is a great chance to kind of talk to people who are really amazing leaders right now. Anurag and Emanuele are hands down one of my favorite commissioners to work with because they're very passionate and they have a wealth of knowledge and experience. So if there's anybody that has burning questions, please do go ahead and chime in. Similarly to yesterday, they will each join the breakout rooms, so you'll be able to kind of talk to them there as well. But if there's anybody that wants to chime in now, I don't see any takers. Okay, maybe we all just want to be a little bit cool today. That's all right too. It's Sunday, I get it. But we'll go ahead and go into breakout rooms now. We've got 3 questions similarly structured as yesterday, where you have step 1 to answer the questions, kind of brainstorm with your group, and step 2 to really kind of hone in on what you want to present for your 90 seconds back in plenary. Adam, I think with that, if there's anything else I've missed, feel free to chime in, but we can go ahead and break up.
10 minutes?
Yeah, we might go to 15, but let's see how it is after 10.
Okay. For the co-hosts, you have to join manually, so you can move. Or
Okay.
if you want me just to send you, I can.
Yeah, go ahead, Adam. I think you can just assign them.
They already went.
Oh, great.
Okay, for the 2 people who are here, do you have difficulty joining? Can you hear me? Can you give any sign that you can hear me? Anything? They left. Okay. I have just 1 person. All right. Sign here. 1, I guess. Okay. Supposedly he's there. Okay. This went well.
Played the questions today. It
We
was
got-
good. Okay.
We got partly to it.
Wonderful. I think we'll jump right in. We'll just start, go ahead with group 1. I'll pass it over to the moderator.
Yes, I will be presenting the findings from our group. So, like biggest skills or most important skills and qualities we figured out are policy creation skills, are publicity and social skills, is like general teamwork and collaboration, and is the general topic of sharing resources. And how can we help more people acquire these attributes? What we found most is a lack of funding in many of these areas. So we're happy if there are more scholarships, if there's more capacity building, which is globally available, and like that there has to be funding to travel to events for everybody who cannot afford it, and like online workshops like this. And what steps could we take next to transform this community would be like the forming of interest groups among communities, but on a global level, then to have collaborations from different youth organizations and to do shared advocacy work like from IFMSA, but also in collaboration. So to have clear advertise, do big global social media campaigns together and get the word out, and spread more, intensify our advocacy efforts. Yeah, that's from group 1.
Wonderful, thank you, group 1. We'll go ahead and pass it over to group 2.
Group 2, I saw a message from Mustafa when I left that he was not having good internet. So could somebody else take over? Iman, would you be maybe willing to summarize the discussions? Because Mustafa said, unless Mustafa internet has improved.
Sorry, I'm at the moment at hospital shift. I can't actually say, sorry.
Okay. Well, let me summarize what I heard, unless one of you is... Yes, go ahead.
Can you hear me?
Go ahead.
Can you confirm if you hear me?
Yes, we can.
Okay, thank you. So regarding our discussions, for the first question, we were trying to discuss what makes someone a successful leader in global health, and we stumbled on some skills, amongst which is advocacy, because of course you need to advocate and mobilize people towards your vision. Public speaking, which serves the same purpose. Active listening, because I mean, as a leader, you'll be surrounded by lots of people who may have lots of interesting ideas. So you need the skill to be aware, to listen to those ideas, and to see which can be incorporated in your vision, which helps this other skill, which is being visionary and taking action based on this vision. And empathy and treating patient. We also discussed the necessity of having experience towards the thing that you're trying to build your vision for. That's for the first question. For the second thing, for how can more young people, particularly from those marginalized communities, acquire these attributes? Of course, we talked about accessibility and education, and trying to see whatever possible platforms that can be used to include young people from those communities. And the other point is peer education, active participation in relevant seminars, and the last point, I think it's just being edited now, is involvement in research projects. And finally, for the third question about the universal health coverage, we talk about youth involvement, policies, advocacy to state, and approaching. I think this point was added recently, sensitization the public, as I believe. So this is a brief summary for what we came up with. discussion.
Thank you very much.
Yes, thank you, Mustafa. I already see some things that are starting to repeat, so that's good news, but also bring on the creativity. Group 3, let's see what you have to say.
We actually didn't have time to have a moderator selected, so if anyone from group 3 would like to jump up so that I'm not doing it again as yesterday.
Okay, I can do it.
Please go ahead, we can hear you well.
Okay, for the first question, we came out of for the trainings and skills and qualities do effective future global health leaders need. We think or we believe that we need to learn how to use evidence-based thinking, and we need to learn about advocacy and lobbying and the intercultural competencies, and also we need to know about the EDI competencies, which I think they are equity, diversity, and inclusive. And for the second question, which is how can more people, particularly those from poor, marginalized communities acquire these attributes? We believe that we need to support open education and use peer-based learning methodologies and inclusive curricula in medical schools.
I'm so sorry, I think we've got a bad connection.
For the last question, which is what steps will you take to the next transform health futures for your community and the world? How can you contribute to achieving universal health coverage? We believe health providers programs and raise the awareness there is any communicable diseases, and decision making, and put some capacity building for the community and curriculum in medical schools.
Okay, thank you so much. I think that was helpful. Yeah, there's a lot of things I want to say, but I'm going to hold off. Go ahead, group 4.
Hi, hello. Okay, so for the first question, we consider that communication publics. Oh, okay, thanks. We consider that communication, public skills, public speaking skills, and networking is part of the pillars of the training of a global health leader. Also, team working, visionary, being a visionary person, being able to adapt to any situation, and of course, having advocacy skills. Also, for the second question, how can more young people can acquire those attributes? We consider that use or getting to know the available platforms that we already have as these opportunities, for example, participate in those will help to train our future global health leaders, and also stay connected and continue the networking that they should create, contacting people that they have worked with on that. And one of the other pillars that we can consider is that the curriculum should include information about global health, about how to be a leader in this, and how to prepare for the future. Also, for the last question, that is here. Okay, what skills could we have? So we consider that the reform of the curriculum should be done, but also in those aspects that we cannot find a way to include in the curriculum officially, we should contact externals and find ways that other people that have more experience on this help us in the training. Also, a creation of global health groups where we can discuss more about this. And the last part, how can we contribute to achieving universal health coverage? Well, one of the things is promote primary health care, but also creation of needs assessment and evaluate what are the needs in our communities and what are the things that we can do about that. Yeah. Thanks.
Thank you so much, Linda. I think actually you raised the point that I had a question out through all of these discussions, was the comment that a lot of groups had around skills and qualities around advocacy, policy creation. But then there seems to be a gap, if I understand correctly, that none of that's really included in the medical school curriculum for anybody that's joining, or is there somebody that has experience specifically where that does exist? Okay. So yeah, I thought that was a really great practical way that you mentioned group 4 of getting external people then involved. Go ahead, Linda, please.
Hi, I will say that we don't have those opportunities in our medical curricula. Well, at least most of the people that I know, but I know that the activities that we do in IFMSA, in our national federations, are really helpful for that. We try to get into all the universities and try to support people to work on this. So, well, I just wanted to add that.
Yeah, that's wonderful. And Iman, just to repeat the question, it was around the referring to question 1 about a lot of groups said policy creation or advocacy skills would be helpful, but that the gap kind of exists in the medical curriculum. And so IFMSA members kind of have a benefit that they get this then through the association part, but that external relations and things like that's the way that young people get it. Go ahead, Doris.
We have like a public health lesson where we have to create different ways we can raise awareness, and it's not through IFMSA. We have it in our curriculum as well. So we do read policies and we have to a little bit analyze them as well, but yes.
And where do you come from, Doris?
I'm from Estonia.
Wonderful, thank you. Iman, I'll pass it to you.
Well, hi. I wanted to share my experience of the last week of what happened in my university. There is something called accreditation for the universities. And last week, actually, it was our university's turn to get accredited. So there were people from Ministry of Health coming to visit our university. So we started advocating for the subject of meaningful youth participation, and which we want a voice in the decision making in our university and in health policy making and education part. So actually we did our part. They promised us to talk to our dean and officials of our university, and we are waiting actually for the report to come out and see how it will go from now on. That's the part of advocacy from my personal experience. It was something recently happened. And since accreditation is so important to my university, we are hoping that they will listen finally.
That's wonderful. Thank you, Iman, for sharing the experience as well. I think we've also done some previous work with IFMSA around a survey that I believe you guys did in 2021 around the medical school curriculum and how digital transformation of health is involved, but also kind of leadership and governance aspects of policy around that. So there is some data that's already been gathered, and we'll see kind of what happens with that in the future. But I think this is a really hot topic, and I'm glad it really came through with the groups. I see that we're running out of time yet again, so I will go ahead and pass it over to Anurag and Emanuele for a couple minutes of closing remarks. I think there's also some conversations in the chat that if you maybe want to have a look at that and bring into your closing remarks, that would be great. Thank you.
Thanks. I will leave the question about a master's degree in global health to Manuel, who knows more about that. I will just add maybe perhaps one thing about the effective part of the question, global health leadership. There are many parts to leadership. The part to effective leadership is to make a difference. And a few things, apart from being visionary, are important, is to have an opportunity to see. And I'm very glad through these international organizations, you're getting a chance to see the world of health through each other's eyes. Because if not had the chance to see, the compassion for other people at a global scale is very unlikely to come. That exposure, both of vision and interest, is critical before you can become a visionary. And I think that is possibly one of the most important things you can do through these international fora. Learn to see through the eyes of others, so you recognize the world is not a flat place at all. Very different challenges, very different problems, very different solutions. No one size fits all. And that humility is the best start to a career in this area. I'll stop here.
And thank you, Anurag. Wonderful words. I want to reflect on two things. One, that a lot of the elements that I saw being on the post-it on Miro, like public speaking capacity, communication skills, teamwork, diplomacy, advocacy. These are skills that can be learned everywhere in the world, working with the colleagues that surround you, and you can nurture them as you go. Then there was another, and so please do invest on those ones, because they are indeed very very important. There were many others that were also listed. In my group was one that was trying to be without biases, which is a challenge, but it's something that we can really train ourselves, our brain, to reduce our biases and open up to intercultural diversity. What has been raised in the comment about the master in public health, but has also surfaced through your exercise, is that there are different words, and access is really inequitable for opportunities out there. I think IFMSA as a structure brings together and reduces those inequities. The work that Whitney has been doing helps to reduce those inequities, and there are more and more opportunities. There are scholarship out there for masters in public health, particularly for people coming from disadvantaged backgrounds, and there is more and more an attempt to have excellent school of public health in different parts of the world that may have not had them in the past. So I would recommend, to depending on where you are, you look into those opportunities and you seek help if there are financial barriers for that, because there's a lot of people also that have realized how these inequities have had an impact on maintaining the structural discrimination in global health that we all have witnessed. And if we are not tackling them now, we're going to see problems be maintained in the future. So I don't have a specific answer, but I'll just say do raise them, do raise those inequities and seek support. And out there's also a lot of people that are ready to support. Over to you, Whitney.
Wonderful. Thank you so much. Is there anybody that has a burning question that has not been answered or has not been able to speak with any concerns at all? Go ahead, Iman, please.
I actually asked it in the chat, is there any opportunity to study in the field of global health leadership or something? Is there a major that we could study, like a double certified during our medical student time?
I'm not aware of one, maybe somebody else's.
I'm not either, but I'm also out of the education system, so I may not be the best person to respond on that.
Yeah, and I guess I'd also just like to say that I came from biology and medicine and went to public health and then went to international affairs, trying to kind of get at that. So I think there's not a direct way, but maybe that's something we could also kind of propose to the rest of the group and see if there's any experiences out there that might be helpful to learn from each other. We are at 3 o'clock. Or at the top of the hour. So I don't have anything else to say from my side. I really appreciate all of your time this weekend. I think this session was extremely insightful. I hope it was, at least for you. We've had great speakers so far, and this really brought a little bit of the personal dynamic, which we were really hoping to get from this leadership session. So Adam, is there anything else I've forgotten that we need to do? I realize that we did not do the final poll, but we'll say that for next week. It's no problem at all.
From my side, everything is well. Thank you. I'd like to say thank you to our speakers on behalf of IFMSA, and thank you to Whitney and to our participants. See you next week.
Yes.
And I see there's still some questions in the chat. You can email those questions to me, and I will see with Whitney if we're able to forward the questions to our speakers later, depending on the nature of the question. And yeah, that's it. And see you next week. Please be on time next week as well, because this is our final session and we also have externals. And picture time.
Picture time. Well, we're all getting ready to cheers. Yes, a big round of applause to Emanuele and Anurag for joining us.